Our ambient station is given 600, and our cycling is 130. 600 divided by 30. Then it's 2 minutes. Okay, so on the quiz or test, you can have any of those combination of time selection. Could be in millisecond, it could be in decimal, or it could be in fraction.
Freaking units.
Questions? Timer of mass timers. Timer is called an automatic exposure control timer, AEC timer, also known as photo timer. AEC and photo timers, it goes hand in hand. So the purpose of the AEC timer is just a device that measures the amount of radiations reaching the film. When a certain amount of radiation had reached the film based on sensor, it will automatically stop the exposure. So when your technique is not high, you use the AEC device because it's an automation. Okay, there's two types of AEC that has been used over the years. Two types, 4 timers. One is called the 4 multiplied 2, and then the other is called the ionizations or ion chamber. The 4 multiplied 2 is an older type of timer, so it's relatively disappearing. With this, it uses a frozen screen that's generally located behind the cassette in the bucket. As the tray goes through and interact with the screen, it luminesces to a certain point. When it hits to that certain degree of brightness, it will automatically terminate the exposure. And it works really fast and instantaneously. The other type of photo timer is the ion chamber or ionization chamber. This is the most common type of photo timer used today in modern imaging system department. The ion chamber is located between the patient and the film. Since it's located between the patient and the film, it has to be really lucent to prevent any artifact. The ion chamber is based on the amount of charges that's produced as it interacts, as the X-ray goes through this ion chamber and this air. When it interacts with the air, it causes the air molecule to be ionized. So when the certain amount of ionization occurs, it then automatically shut down the exposure. That's what pretty much is. Diagram. 4 multiplied 2, the page behind the bucket. Ion chamber is between the patient and the film, so it has to be very lucent. Other differences, where it's located. Looks like that will be my quiz. When we use the AEC device, the purpose of the AEC device is to give the technology a consistent radiograph of the cell anatomy of different patients. So it helps produce a consistent quality of X-rays. In order to use the AEC correctly, you have to position the patients very well. So positioning skill is very important when we're using AEC. With the AEC, there's sensor cells built within it. These will be the sensor cell. If you do a chest X-ray, you can patient the patient's against the board, and then when you use the AC, these two cells will be activated to make sure that enough radiation going through for them to sensor it. So depending what type of anatomy you're looking at, these cells will activate and some will just turn off. So page position is very crucial with AAC. And of course, all AAC devices have a backup timer in the event that it doesn't terminate the exposure. The backup timer is usually set at 150% above your timing, which sounds a lot, but in terms of how much time selection is there, it's in fraction of a second. If you set your time at 0.5 a second, 150 above that would be 1.5. So it's just like that. Any questions? On the one sliding, it's just an equipment. It's funnel generator is built because it's a time timer, so it has a funnel load generator. And again, the purpose of the funnel load generator is to help deliver the maximum MA with the shortest exposure time, with whatever KV selection you have. It then continues to reduce the power as the exposure continues. So instead of the highest MA, as the exposure continues, the MA station will change, fluctuate based on your exposure. That's why I call it funnel load generator. The MA changes or goes down as your time duration continues. And I'm losing my voice. And let's take a break too. Oh my God. It's almost 6:27, 6:40.